Okay, a very good evening to all the participants. We are grateful for again for all of you to spending your precious Sunday to attend our webinar today, introducing Dr. Jennifer Paula Sai Narvaez from Philippines. First of all, let me have a brief introduction of Dr. Jennifer. She is an aesthetic gynecology training, Better Medical Institute, London, UK, fellow Philippines Obstetrical and Gynecological Society, senior member, European Society of Aesthetic Gynecology, APTOS Intimate International Trainer, and she is also our fellow FATS International Faculty. Key opinion leader and local expert Nuvia Intimate founding member, Philippine Society of Fertility Preservation Associate, Pan Pacific Aesthetic Institute Foundation. Without waiting ado, may I pass on the slides to Dr. Jennifer Narvaez. You can start sharing your presentation, Doctor.
Good evening, everyone. Eddie, can you hear me? Thank you
Yes,
for
up
that
and
kind
clear.
introduction. Can you see my slides now?
Yes.
Okay, so glad to see everybody in this Sunday evening. So for tonight, I'll be talking about fat grafting application on female intimate area. So these are my objectives to briefly discuss fat harvesting techniques, processing, indications on female intimate area, and techniques of application. So again, fat grafting is also known as your fat transfer. It's a surgical procedure that involves extracting the adipose fat by liposuction, processing it, and then reinjecting purified fat into the area that needs improvement. So it starts since 1893, where it was applied on a large pit on the cheek caused by a tubercular inflammation of the bone. And later on, they applied it to rejuvenate a periorbital scar. And then in 1908, you'll see here that they first described a technique for using a needle and syringe to transplant fatty tissues. And in 1990, it was standardized by Dr. Sidney Coleman as called the Coleman technique, which is the world's gold standard for fat grafting after 3 decades of clinical application. So, adipose tissue is the largest endocrine organ. I know that everybody hates to be fat, but your fats has the following advantages. So it stores your energy, burns calories, and thermoregulates. It helps you control your blood sugar and insulin levels. And most importantly, it is a significant source of adult stem cells. So your adipose tissue, once it's degraded either enzymatically or non-enzymatically through your mechanical degradation, so it yields this stromal vascular fraction or your SVFs, giving off the following cells: your adipose-derived stromal cells, your ADSCs, your EPCs, pericytes. Basically, this will function to synthesize and secrete the following growth factors, which are very important for angiogenesis, your immunoregulation, and anti-inflammatory function. So in techniques of fat grafting, the step one, we do fat harvesting. We select the donor sites. It's been said that your abdomen as well as your thighs contains or yields higher concentration of your stem cells. Tools and technologies, manual versus power assisted. We normally don't use power assisted here because we are just dealing with small volume of fat. So we ensure viability through your gentle techniques. Step two would require you to do your fat processing. Purification methods are as follows. We can do centrifugation, filtration, sedimentation. This will usually require washing. So the importance of fat viability and handling is also emphasized here. Your step three, your fat injection. describes your fat injection techniques for optimal survival and distribution, layering and micro droplet techniques for natural results, and how to avoid your complications. So again, once you harvest the fats, you centrifuge it, either you centrifuge or you do decantation or sedimentation. So you decant the less dense oily layer, and then you release the dense aqueous component below. You do wick. This involves application of like a filter paper to remove the supernatant oil here, and then you transfer it to a smaller syringe. So how do we harvest fats? So again, as I've said, it's been said that the highest concentration of your stem cells are located in the fatty tissue harvested from your lower abdomen as well as your inner thighs. Actually, there's no ideal tissue donor. So ultimately, choosing a site should be based on the ease and safety of access as well as the preference and request of the patient. So this is your Klein solution, also known as your tumescent solution. So since we're dealing with a small volume of fat harvesting, half liter of your saline solution is enough. So we add 25 ml of your 1% lidocaine, zero point 0.5 milligram or half ml of your epinephrine for vasoconstriction, and your bicarbonate, which serves as an alkalinizing solution to your acidic lidocaine. So the ratio of aspirated fat to tumescent solution should be about 1:1. So don't forget to wait for the solution to settle before actually harvesting fats. We normally wait around 30 minutes at least. So this is your 9-hole harvesting cannulas as suggested by Dr. Sidney Coleman. So we attach this one to a 10 cc syringe. So 10 cc syringe are preferred for harvesting. Why? Because we do the act of liposuction, we normally pull the plunger. So from the negative pressure that from pulling of the plunger, we basically do the act of liposuction, and while doing that, we are giving that negative pressure, as I've said. So if imagine if you're using a larger syringe, more than 10 cc, it would be harder for you to pull the plunger. So in female intimate application, I normally try to harvest less than 200 cc or mil of your fats. That's actually more than enough. So we have to seal it. So this is your syringe, 10 cc syringe attached to your harvesting cannula. So if we're going to do decantation or your sedimentation or centrifugation, it's important to plug it on the other end to prevent spillage and contamination. So again, there are different ways to separate the layers. We can do sedimentation, centrifugation, but it's suggested to centrifuge at 3000 RPM for 3 minutes to isolate the fat and to minimize the trauma.
Next step is nanofat grafting. Here we shift from volume augmentation to cell therapy. The idea is to mechanically destroy the adipocytes present in the fat tissue. The fat is harvested with the multi-hole sharpened microcannulas, and then the microfat is emulsified sequentially, first with a 2.4 millimeter emulsifier, and then with a smaller 1.2 millimeter emulsifier. The reason why we do this in a progressive two-stage technique is that if you only emulsify through a 2.4 millimeter opening, it is likely that not all the fat cells are destroyed, resulting in possible fat show in the skin. The emulsification is typically done 30 times, after which you can see the change in the color and the consistency of the fat, followed by a second emulsification with the 1.2 millimeter emulsifier for another 30 times. The reason why we don't emulsify the fat primarily through the 1.2 opening is that sometimes the fat is too fibrous to emulsify it through the small opening. This is an animation that shows you what possibly happens on the cellular level. The emulsification destroys the larger adipocytes, leaving the smaller cells of the stromal vascular fraction intact. Here you can see the difference between the nanofat and the microfat. Then the fat is filtered through a double 400-600 micron filter developed by the Tulip company. This filtering is necessary to remove the fibrous remnants present in the nanofat, which will block our 27 gauge needle. This is done just one time. Some air can be injected into the chamber to empty the chamber and reduce the spill of nanofat. If you open the device, you can see the fibrous remnant present on the top of the filter, which will block our 27G needle.
Okay, so that video shows how we normally process the fats to make it functional. So again, the microfat are your small fat parcels measuring 1.2 millimeter or smaller. So this is ideal for replenishing superficial fat compartments because of its volumizing effect and is the best option for as subdermal filler. In female intimate application, this will be perfect and suitable for your labia majora augmentation. Your nanofat, your stromal vascular tissue consists of tiny parcels ranging from 400 to 600 microns in size, and basically is a liquid-rich substance containing stromal vascular cells, your matrix elements, free fatty acids, with no remaining viable fat cells, meaning this will not give you volume. So I normally inject this one on intravaginal canal, especially when the patient's complaining of vaginal dryness, on the G spot to enhance and improve your sensitivity using sniff technique. And you can also put this one on the skin outside on your labia majora, especially on the scarred tissues from episorrhaphy or from your giving birth. So there's another way to digest of the fats. So what we mentioned about a while ago is your mechanical way. This one is compares the enzymatic as well as the mechanical method. So it's by the use of an enzyme. What we usually use is your collagenase. So after fat harvesting, you mix the enzymes, centrifuge it a couple of times before extracting your stromal vascular fluid. So it has higher stem cell yield and more purified cell suspension, but is more expensive and time consuming as compared to your mechanical isolation, which is readily available, it's more cost effective, it's easy to use, it's rapid, and it keeps the cell matrix contacts. So how do we apply this now in the field of gynecology on your female intimate area? So the following are the signs and symptoms that we usually see on a gynecology clinic. So patient usually come in because of vaginal dryness, irritation, recurrent infection, your pain during sexual intercourse, laxity, sexual dissatisfaction, stress incontinence, low self-esteem, as well as your low self-confidence. So you can see here in comparison to a young intimate area as compared to your menopausal female organs. So you'll see that there is marked thinning of your vaginal epithelium. Even the blood vessels are markedly decreased. Your rete ridges are, it's almost, you cannot appreciate it anymore. The vagina narrows as well as thins out. Mainly, the culprit will be your loss of estrogen, as seen on during your menopause. And as we know, estrogen receptors are heavily found in your vagina, urethra, bladder trigone, as well as your pelvic floor. Histologically, this is the vaginal lining. So you'll see the white material here on the superficial cell. These are glycogen contents. That's very important, that maintains your vaginal acidity, preventing you from getting that pathogens. We tend to lose it as we age. You will see the rete ridges that anchors on the vaginal epithelium. It's almost gone. And your blood vessels are likewise decreased. So what do we apply? What's important on the female intimate area are these two, your microfat as well as your nanofat. So again, the molecular composition of your nanofats, it contains this following growth factors, your vascular endothelial growth factor, your PDGF, this biological peptides, cytokines, as well as your vascular components important for tissue regeneration. So again, your vulva, we normally put microfat here to improve the volume as well as it brings that regenerative capacity. Your nanofat are usually placed on the vagina intravaginally as well as your G-spot, and you can apply this on the vulva as well to improve vaginal dryness on the skin. So why do we apply? Basically, it restores the volume, restores the function, improve the comfort and increased sensation, improves aesthetic appearance, and ultimately, it regenerates the tissues. So anatomically, you'll see here the skin of your labia majora followed by your superficial fascia. As next is your subcutaneous tissue. This is where you put your microfat. So not deeper than that, because deeper than that, you have your major vessels and your muscles. It will be very bloody and very dangerous. So if you're doing this already, you'll notice that whenever you put that entry point, there's quite a resistance on the superficial fascia because this fascia is actually the continuity of your colles fascia on the abdomen. The counterpart on the male is your dartos fascia. Okay? So you have to pass through that fascia for you to put the microfat on your subcutaneous layer. So again, intravaginally, what's important to regenerate here is your lamina propria, particularly that layer, because it consists that connective tissue that's rich in collagen and elastic fibers. It contains some vessels, mainly capillaries, fibroblasts, lymphocytes, and is important to support the trophism of the vaginal lining and the architecture of your vaginal wall. These are the following advantages. Of course, since this is autologous, no risk of rejection, no allergic reaction, it's homogeneous and natural looking and longer lasting. Complications are as follows. Edema and bruising are very common, especially on the donor side. Contour irregularity, oral cysts, and fat necrosis are not much, especially on the female intimate area. Infection and bleeding, and of course, your fat embolism. So these are the following indications. It's very good for vaginal dryness, irritation, improvement of your sexual function, pain during intercourse, G-spot amplification, your incontinence, especially your lichen sclerosus, eczema, psoriasis, and scarred and fibrous tissue. The following are your contraindications. So we normally use these three questionnaires. These are internationally validated questionnaires to check for improvement. So your FSFI or your female sexual function index measures 6 domains: your sexual desire, arousal, lubrication, orgasm, satisfaction, as well as the pain. Your visual analog scale measures your pain, irritation, burning sensation. Your VHI or your Vaginal Health Index measures the following: your elasticity, secretions, pH, epithelial mucous membrane, and your hydration. So this is a study that showed among 20 patients. This study was done in 2017 to 2020. So they approximately infuse 20 mils of your fats in intravaginally and 20 ml on the vulva as well as the mons. And there is significant improvement of your FSFI. And as well as they tested this histologically, and immunohistochemical staining was likewise done. So it showed neocollagenesis, neoangiogenesis, and increased estrogen receptors. So the level of protein gene products 9.5, which is associated with neuropathic pain, was likewise decreased. So another study done in 2023, which showed the synergistic effect of your PRP and your adipose-derived stem cells showed improvement on patients with lichen sclerosus. Basically, there's significant improvement of pain, burning sensation, and discomfort. So another study showing how nanofat contains regenerative effect with tissue remodeling potential. So this study showed that 33 women with scarred vulvar lichen sclerosus, there's significant improvement of itching, burning, soreness, and pain, and there's improvement of overall emotional relationship and alleviation of depression. So some of my patients before and after results. So this is before, immediately after, and then this one is around 4 years after your fat grafting. Still, it didn't go back to its baseline. So again, before and immediately after. Another patient before and after. So again, this one before and after fat grafting. This one is the most recent one. So you'll see that there is marked improvement of the labia majora. So you see there's nice results of the before and after, but nothing compares to the way the patient feels about themselves because it has really greatly alleviated the pain and discomfort that they're feeling. So, in conclusion, so fat grafting is an excellent alternative to improve the structure as well as the function of the female intimate area, and the regenerative capacity of the adipose tissue has the potential to alleviate the symptoms, restore the function, as well as improve the aesthetic appearance. Thank you for listening. So, I'm inviting you to join me in Bangkok, Thailand on July 11 to 13 for actual hands-on workshop.
Thank you, Dr. Nawais, Dr. Jennifer. Now we open up if there's any question from the floor, you can either type on the chat or you can let you ask direct questions. Open up the floor today. We have a question here, Dr. Jennifer. I think you also do as same like all those like facial injection. What will be the main difference in your uh, opinion between filler injection and fat injection to the female
Okay.
intimate area?
Mhm. Okay. Eddie fillers will give that volumizing effect. Same way with the fat, but there's no regenerative capacity as compared to your fat grafting because aside from the volume, there is stem cell that you're basically putting. Fillers are lasts for around 9 to 12, maximum of 12 months. With fats, it's really long lasting. Usually, my patients would see results maximum of around less than 5 years. On the average, is around 3 to 4 years. They normally feel the effect still. So it's longer lasting than your fillers. Of course, fillers are easier to do, easier to open. You don't need harvesting. But ultimately, if the patient's really, really is, if they have worst kind of your genital urinary syndrome of menopause, worst kind of your dryness, of course, my ultimate treatment would be fat grafting.
But do you do this procedure, fat grafting, as the stand-alone just for the female intimate area? Or I think in your practice, maybe with Alvin, he also does a lot of facial injection, breast injection. Is a combination surgery or just a standalone surgery?
Usually, there are certain gynecologic patients who will really come to me solely because of that. But mostly, since the fat is already there, it's very easy to harvest and you can get, a lot. Normally, it's more than enough for the intimate area. You can put it on the face, on your breasts, sometimes on the buttocks. So usually, it's in
Mm,
combination.
okay. But just now you mentioned if fat grafting, it will be effect for about 12 to 24 months.
Mm-hmm.
Yeah. Mm, okay. All right. Are there any questions from the floor? I think there is one question, I guess. Yeah, from Dr. Farhan Zahid. At what level or layer you inject nanofat into vaginal wall?
Okay. Thank you for that question, Dr. Fahan. So I normally inject it sniff technique, right? So you just inject around 2 millimeter maximum of 4 millimeter of your needle. Sniff technique. So don't go deeper than that. So very superficial.
Yep. Another question from Dr. Farhan Zahid. Does microfat grafting do vagina tightening?
I never tried using that one because there's other modality that I think is more superior than that. As for example, your surgical vaginoplasty or your minimally invasive thread lifting for the vaginal laxity, and it's very dangerous because you might hit there's a lot of vessels intravaginally, so better not to do microfat down there. I don't even use cannula, so it's just sniff.
I think touching on this microfat, I think last week our webinar by BSL, Mr. Peter Jung, where he's discussing about the resizing of the fat, which is according to Peter is totally not the same as nano fat. What is your opinion on the different sizes of fat injection to the female genital? Is it do you require different sizes of fat for different layer or different part of the vagina?
Actually, microfat is does excellently work on the labia majora if you're trying to augment that one. But because that one gives you that volume, right? You wouldn't need your millifat as well as your macro fat. Your microfat is actually more than enough. You won't need the macro and the milli. So it gives that volume just right for the female intimate area. Well, if you compare it to a larger organ like your breast, of course, you would need bigger amount of fat and maybe greater in size. But on the female intimate area, your microfat works just fine and excellent. Hello, Eddie? Hello? Hi, can you hear me? Eddie, are you there?
Yeah, yeah, yeah. Sorry, I was my internet was paused for a while.
Okay. Did I answer
Okay.
your question?
Yes. I think. Sorry. Just now, I think my internet was not stable. Now I'm back. There's one question from my dear friend, Dr. Raymond Wijaja Hakim. Okay. What is the aftercare for the fat transfer is done, is also done for in the vagina area? What will be the aftercare?
Okay, for female intimate area, I require them to wash every after urination, every after bowel movement for the first 2 weeks. And the wash should contain antiseptic component. So it cannot be like your just normal daily intimate hygiene. And then you have to ask them to wear an underwear that's enough gives you that enough tightness. You don't need any form of compression because normal panties or normal underwears, just not thongs, would give them that right amount of compression. Same, you put the antiseptic, betadine solution or any form of your antiseptic on the entry and exit points. And basically, that's it. Sexual intercourse, they can resume after 3 weeks at least.
Okay. Okay, I think another question again from Dr. Farhan Zahid. After nano grafting into vagina wall through sniff technique, and what time patient may resume the sexual intercourse? I think you have answered just now,
Yeah,
3 weeks, right?
3 weeks. Yeah.
It's a bit too long, yeah. Okay.
There's other ways, and
Okay. Yep. Are there any more questions from the floor? before we let Jennifer back going out for the dinner with her beloved family. Okay, if there's no more questions, we shall let me see this as another more question. Yeah, I think yeah. There's no more. Yeah, yeah. Sorry, there's one more
Oh,
question
sorry, that's
from Dr. Farhan Tahid. I think we need to charge him a bit more. He asked a lot of questions, Dr. Farhan. Do
Dr.
you
Farhan
ever
wants
use
to
micro?
attend July workshop.
Yeah. Last question. Do you ever use micro grafting into labia minora?
We normally people well, most of the female, at least here, Filipino women in the Philippines, of course, they want to get rid of that labia minora. So I haven't heard of a person or a woman that wanted to show or off her labia minora. So I normally don't do fat grafting down there on the labia minora per se.
Okay. Thank you, Dr. Jennifer Paula. So I think, as you can see from the screen, we have our beautiful Dr. Jennifer, flanked by two handsome Korean surgeon for our upcoming hands-on live surgery workshop in Bangkok, Thailand, which is scheduled on the 11th to 13th of July. Each day we have a different procedure performed by different experts. So we have aesthetic regenerative application for facial and by Dr. Chris from Korea. And of course, Dr. Jennifer will share her expertise in female genitalia rejuvenation technique as what she have discussed today. And last but not least, Dr. Ju from Korea will be discussing about cosmetic hair restoration in terms of using SVF. Okay, interesting. One more question. One more question. Okay, one more question. I think we have chat. Okay, sorry. Oh, actually, we have a few more questions. Do you mind taking it,
No
Jennifer?
problem, since we're here already. So I saw
Yeah, it's
this
also from
question, what's the difference between exosomes?
yeah.
So exosomes are acts like a messenger. It basically delivers your growth factors to the cell, right? As compared to your fat grafting, which wherein you inject the growth factors and then improve on your fibroblasts, etc. And first and foremost, your exosomes, we cannot inject it. Of course, there are certain countries that are very, very strict about it. It's not yet legally acceptable to inject your exosomes. So it will not give you that volumizing effect. So, with regards to lubrication, your exosomes and your fat grafting will be, fair. They're equal with regards to the result. But again, fat grafting will be longer lasting.
I think there's one more question from
Penile
that
enlarged.
Peanut and
Yeah. Yes, fat grafting is usually done down there on male and for penile enlargement. I normally don't do that. It's my husband who does that, but yes, it works well as well.
okay. I think with that, I think we at the end of the session. Thank you very much, Dr. Jennifer, again for your sharing and this webinar. And my many thanks to all the participants, all the friends. I see some uh, s- very regular friends that I have. Thank you very much for joining. With that, we will call this webinar close for the night. And do join us in Bangkok and learn from Dr. Jennifer in her workshop. Okay. Thank you, guys. Thank you
Thank
very
you,
much and good night.
everybody. Thanks,
Yeah, good
Eddie.
night. Good night. Good night.